Imagine feeling overwhelmed, constantly stressed, and unable to cope. This is a reality for many. Mental health is crucial for everyone's well-being. It affects how we think, feel, and relate to others. Cultural and social factors shape our understanding of mental health. Let's explore what mental health means and how we can promote well-being, with a particular attention to Zambian context. Mental health is defined as a state of well-being. It allows individuals to realize their abilities and cope with life stresses. It's more than just the absence of mental illness. In Zambia, we must consider the impact of poverty, unemployment, and limited health access. Our extended families and community networks provide critical support. To better understand mental health, we can break it down into key domains. These include emotional well-being, cognitive functioning, social connectedness, purpose, and physical health. Emotional well-being is about managing and expressing emotions. Many Zambians rely on community and spiritual support to stay balanced. Cognitive functioning is the ability to think clearly and solve problems. In Zambia, issues like poverty can create significant cognitive stressors. Next is social connectedness, which focuses on the quality of our relationships. Zambian communities often provide essential support, but stigma can lead to social exclusion. Purpose relates to engaging in meaningful activities like work, education, and caregiving. Unfortunately, high youth unemployment makes this difficult. Now, let's explore how to promote mental well-being. We can implement strategies at various levels: individual, family, and community. First, building resilience is key. This means strengthening coping skills and emotional regulation. Individuals can learn techniques for managing stress and emotions. Community programs can support families and enhance communication networks. Schools can promote resilience through life skills education, preparing youth for challenges. Preventive interventions are also crucial. Schools can run programs to teach social-emotional skills and manage bullying. Psychoeducation can raise awareness of mental health problems and normalize seeking help. Community outreach can train leaders to identify and address mental distress. Addressing cultural sensitivity is vital. Collaborating with traditional healers and respecting local beliefs can create more effective care. Integrating cultural practices into mental health interventions ensures better understanding and acceptance. Implementing these strategies requires attention to several factors. Workforce development is essential, as Zambia faces a shortage of mental health professionals. Policy financing should support integrating mental health into broader healthcare services. Reducing stigma is critical for promoting help-seeking behavior. It's necessary to involve people with lived experience in these efforts. Lastly, intersectoral collaboration enhances the impact of mental health promotion, especially for vulnerable populations. In education, teachers can implement mental health programs and support distressed learners. Social workers can advocate for vulnerable communities, while theological training enhances pastoral care's capacity. Employers can promote workplace wellness through supportive policies. In summary, mental health is vital to individual and community flourishing. In Zambia, we need culturally adapted strategies that build resilience, prevent mental disorders, and provide accessible care. Let's work together to create environments that empower everyone to thrive. If you're a practitioner or interested in mental health, consider engaging with local support systems. Inform your community and contribute to a healthier society. The journey to mental wellness starts with us, together.